Ever get that nagging feeling that you're not sleeping as well as you could be? Well, today we're going to equip you with enough knowledge about sleep disorders to impress even a sleep specialist. We're diving into a medical textbook chapter that focuses on sleep disordered breathing, and trust me, it's way more interesting than it sounds.
It really is. By the end of this, you'll understand what's happening during those restless nights and maybe even recognize some signs in yourself or others.
So, no more showing up to work in your pajamas.
Hopefully not. But on a serious note, this isn't about sleepwalking or bizarre dreams. We're talking about the mechanics of breathing gone wrong while you're asleep.
Okay, let's decode this. Where do we even start?
Well, just like any specialized field, sleep medicine has its own language. We need to get familiar with some common terms like apnea, hypopnea, and arousals.
Apnea, that's the one where you completely stop breathing, right? Like mid snore. A bit alarming.
That's the one. And there are actually two main types of apnea, obstructive and central. Obstructive is when something physically blocks your airways, like your tongue or soft palate. Central apnea is a bit weirder. It's when your brain simply forgets to tell you to breathe.
So, like your brain is taking a coffee break at the worst possible time.
Exactly. Then we have hypopnea, which is similar to apnea but less severe. Instead of a complete stop, your breathing becomes very shallow or slow.
Okay, so both are disrupting your breathing, but apnea is the all-out stop, and hypopnea is more like a nearless.
Got it. What about arousals? I feel like I've heard that term thrown around.
Arousals are those mini awakenings that disrupt your sleep cycle. They're often caused by those apneas or hypopneas we just talked about. You might not even remember them, but they leave you feeling exhausted even after a supposed full night's sleep.
Sneaky little things. So doctors use these terms, these clues, to figure out what specific sleep disorder is at play. It's like they're sleep detectives. A very apt comparison. And this chapter zeroes in on a big one. Obstructive sleep apnea, or OSA for short. It's the most common sleep-related breathing disorder and affects millions.
Okay, so more than just an occasional snore.
Much more. Picture this. You're asleep, your muscles relax, including those in your throat. But with OSA, this relaxation causes the upper airway to collapse, repeatedly blocking airflow.
So your throat is literally closing up while you sleep. No wonder people wake up gasping for air.
Exactly. Your brain panics, jolting you awake just long enough to take a breath. And this can happen dozens or even hundreds of times a night.
No wonder people with OSA feel tired all the time. They're basically running a marathon in their sleep. But I thought snoring was the telltale sign.
Snoring is definitely a red flag, but OSA is far more insidious. Think daytime sleepiness, irritability, difficulty concentrating, even morning headaches. Some studies even suggest a link between OSA and sexual problems.
Wow, that's a lot more serious than just a noisy night for your partner. So how is OSA diagnosed? Do you have to sleep in a lab with wires coming out of your head?
Well, a sleep study is usually involved, but first, doctors look for specific signs. And here's where it gets really interesting. You don't need hundreds of apneas per hour to get a diagnosis.
Oh, tell me more.
If you have symptoms like the ones we just discussed, just 5 or more apneas or hypopneas per hour could be enough for an OSA diagnosis.
5? That doesn't seem like a lot. I'm starting to get a little nervous about my own sleep habits.
That's why understanding these details is so important. It helps you know what questions to ask your doctor.
Okay, good point. So back to sleep studies. Are those always done in a lab? What happens during one?
There are actually a couple of types. The gold standard is a full night study in a sleep app, where you're hooked up to all sorts of monitors to track brain activity, eye movements, breathing, and even your blood oxygen levels.
They really analyze everything.
They do, but there's also a split night study. The first half is diagnostic, and if OFA is confirmed, they can start treatment right then and there, usually with a CPAP machine.
So it's like a two-for-one deal, diagnosis and treatment all in one night. That's pretty efficient.
It is. The study also measures your AHI, or apnea-hypopnea index, which tells you how many times per hour your breathing is disrupted. So imagine your AHI is 20. That means you're having 20 breathing interruptions every hour while you sleep.
Whoa, that puts it into perspective. Suddenly, 5 doesn't seem like such a small number anymore.
Exactly. And this AHI number helps doctors determine the severity of your OSA and guide treatment decisions.
So obstructive sleep apnea, where something is blocking the airway, is pretty common and pretty serious. But what happens when it's not a physical blockage? That's where central sleep apnea comes in, right?
Exactly. And that's where things get really fascinating. We'll delve into that after a quick word from our sponsor.
Okay, so we've tackled obstructive sleep apnea, where something is physically blocking the airway, but now we're moving into the brain's domain with central sleep apnea, or CSA. What's the story there?
With CSA, it's not a blocked airway that's the issue. It's the brain failing to send the signal to breathe, almost like it just forgets.
Like it's skipping a step in the whole breathing process? That sounds a little unsettling.
It is, and this can happen for a couple of different reasons. In primary CSA, there's simply no stimulus to breathe. Your brain thinks you have enough oxygen, so it doesn't bother telling your body to inhale.
But we need a constant supply of oxygen, right? Our bodies don't just store it up for later.
Exactly. That's why primary CSA is relatively rare. More often we see secondary CSA, which is caused by another underlying condition.
So it's a symptom of something else going wrong in the body.
Precisely. It could be a central nervous system disorder, certain medications, even chronic obstructive pulmonary disease, or COPD. They can all disrupt the brain's ability to regulate breathing during sleep.
So many different things can impact our sleep without us realizing it. It's like a domino effect. But hold on, you mentioned different types of central sleep apnea. This is where my brain might need a coffee break.
Fair enough. Let's keep it simple and focus on one intriguing type, Cheyne-Stokes breathing. It's often seen in people with heart failure.
Chain scopes, that sounds a bit like a 19th century detective duo. What happens with this breathing pattern?
It's actually a cyclical pattern where your breathing gradually increases in depth and frequency, then decreases, followed by a period of apnea, and then the cycle repeats.
So it's not a consistent pause in breathing, but more like a wave, ebbing and flowing.
Exactly. And this pattern, along with the underlying heart condition, contributes to the development of central sleep apnea.
So we've got obstructive sleep apnea, central sleep apnea. Are there any other sleep disordered breathing culprits we need to know about?
There's one more we should touch on, mixed sleep apnea. It's basically a combination of both obstructive and central events happening in the same night.
Ah, the best of both worlds, said no one ever. So you're dealing with both a physical blockage and a brain that occasionally forgets to breathe. That sounds complicated.
It definitely adds another layer of complexity to diagnosis and treatment. Doctors need to figure out which type of apnea is dominant to determine the best course of action.
Speaking of complications, I remember you mentioned a surprising connection between central sleep apnea and a heart condition. Tell me more about that.
Right, it's fascinating. Central sleep apnea, particularly the Cheyne-Stokes type, is often associated with atrial fibrillation.
Atrial fibrillation, that's an irregular heartbeat, right?
Exactly. It's a condition where the upper chambers of the heart, the atria, beat chaotically and out of sync with the lower chambers.
And not only is your breathing out of whack, but your heart rhythm is too. This is definitely a good reminder that sleep health is connected to our overall well-being.
Absolutely. And this brings us to another group of disorders known as sleep-related hypoventilation and hypoxemia syndromes, or SRHHS for short. These conditions involve abnormal gas exchange during sleep, meaning your body struggles to get enough oxygen or get rid of enough carbon dioxide.
So your breathing isn't working efficiently while you're asleep.
Right. And one example is obesity hypoventilation syndrome, which is often associated with, well, obesity.
I was going to say that name is pretty self-explanatory.
It is. But there's also overlap syndrome, which is basically a combination of OSA and obesity hypoventilation syndrome.
A double whammy of breathing problems.
You could say that. And it's important to note that even common conditions like chronic bronchitis and emphysema, while not automatic SRHS qualifiers, should be red flags for potential sleep-related breathing issues.
So even if you have a lung condition, you could have underlying sleep disorder making things worse. That's good information for people to have.
Definitely. And this is why diagnosis is so crucial. Let's shift gears and talk about how doctors unravel this whole sleep disorder puzzle.
Sounds good to me. How do they even begin to figure out what's going on?
It all starts with a comprehensive sleep evaluation, which includes a detailed medical history, symptom review, and physical exam.
So they're playing detective, gathering all the clues.
Exactly. They'll ask about your sleep habit, any medications you're taking, and your overall health. They might even use a tool called the Mallampati score, which is a quick visual assessment of your upper airway.
They're literally looking down your throat to see if it's prone to collapsing.
In a nutshell, yes. And depending on the suspected diagnosis, they might order additional tests like pulmonary function tests to assess your lung function, blood tests to check oxygen and carbon dioxide levels, or even an electrocardiogram to assess your heart rhythm.
They're really leaving no stone unturned.
They want to make sure they're getting a complete picture. But the most important test for diagnosing sleep disorders is the polysomnography, or sleep study.
Right, we talked about those earlier, the full night, the split night, and the in-home versions.
Exactly. During a sleep study, you're hooked up to monitors that track everything from brain activity to breathing patterns to blood oxygen levels. It's like giving your sleep a full health checkup.
No wonder they call it the gold standard. They're getting all the data.
They are. And while we're on the topic of data, let's talk about sleep stages for a bit. It might seem like a technical detail, but it's actually pretty fascinating.
Okay, I'm intrigued. Take us through the stages of sleep.
There's stage 1, where you're drifting off and your breathing becomes more regular. Then you move into stage 2, which is light sleep, where your heart rate and body temperature drop slightly. Stage 3 is deep sleep. That's when you're really out and difficult to wake up. It's also when things like sleepwalking and night terrors tend to happen.
So that's when the spooky stuff comes out.
You could say that. And finally, we have REM sleep, where your brain is very active, your eyes dart around under your eyelids, and most dreaming occurs.
Aha! So that's where all those weird and wonderful dreams take place.
Exactly. And here's a fun fact. In REM sleep, most of your muscles are temporarily paralyzed.
Wait, paralyzed? Why?
It's thought to prevent you from acting out your dreams. Imagine trying to fly or fight off a monster while you're asleep.
Yeah, I think I'll take muscle paralysis over sleep curate, chopping my nightstand any day. But why are these sleep stages important in diagnosing sleep disorders?
Because the distribution and quality of these stages can provide valuable insights into the nature of a sleep problem. For example, someone with OSA might spend very little time in deep sleep, while someone with insomnia might struggle to even reach stage 1.
So it's not just about how long you sleep, but the quality of that sleep and how you cycle through the different stages. That makes a lot of sense.
Exactly. And all of this information, the sleep history, the physical exam, the test results, and the sleep study data, it all comes together to help doctors pinpoint the specific sleep disorder and determine the most effective treatment plan.
So it's like piecing together a puzzle to figure out how to get you back to sleeping soundly.
A perfect analogy. And speaking of treatment, there are actually a variety of options depending on the type and severity of the sleep disorder.
Okay, so let's talk solutions. What can people do to reclaim their sleep?
Sometimes simple lifestyle changes can make a big difference. Things like losing weight if you're overweight, avoiding alcohol and caffeine before bed, and establishing a regular sleep schedule can significantly improve sleep quality.
So you don't always need fancy machines or medications.
Not always. But for moderate to severe cases of OSA, for example, positive pressure devices like CPAP or BiPAP are often the go-to treatment.
Remind us how those work again?
They deliver pressurized air through a mask you wear while you sleep, which keeps your airway open and prevents those disruptive apneas.
So it's like a gentle breeze blowing through your nose all night long.
Pretty much. And for some people, a custom-fitted oral appliance, kind of like a mouth guard, can help reposition the jaw and tongue to prevent airway collapse.
So there are options besides wearing a mask. That's good to know.
Absolutely. And in certain cases, surgery might be recommended to remove excess tissue or correct structural abnormalities in the airway.
So if all else fails, they can go in and physically fix the problem.
Exactly. And for certain types of central sleep apnea, there are even implanted stimulators that can help regulate breathing.
Wow, that's incredible. Can you tell us more about how these stimulators actually work?
They're similar to pacemakers for the heart, but instead of regulating heart rhythm, they stimulate the nerves that control the muscles involved in breathing. This helps ensure that those muscles receive the signal to breathe, even when the brain isn't doing its job properly.
It's amazing how technology can step in and essentially take over for a malfunctioning part of the body.
It is. And with central sleep apnea, treatment often focuses on addressing the underlying cause, if there is one. But there are also specific therapies for the different types of CSA.
So different approaches for different breathing patterns. Makes sense. Give us a breakdown of the options.
For example, for the Cheyne-Stokes breathing pattern we discussed earlier, treatments like adaptive servoventilation or ASV might be used. This type of therapy constantly monitors your breathing and adjusts the air pressure to maintain a steady breathing pattern, preventing those dramatic increases and decreases in airflow.
It's like a smart machine that learns your breathing habits and keeps everything running smoothly.
Exactly. And for other types of central sleep apnea, BiPAP with a backup rate might be recommended. This ensures that you're taking a minimum number of breaths per minute, even if your brain forgets to send the signal.
It's like having a safety net for your breathing. That's reassuring.
It is. And keep in mind that these treatments aren't just for central sleep apnea. They can be used for other sleep-disordered breathing conditions as well, depending on the individual situation.
This is also fascinating. It's like a whole hidden world of sleep disorders that most people don't even know about.
It is, and it's crucial to seek professional evaluation if you suspect you might have a sleep disorder. With proper diagnosis and treatment, restful nights are definitely achievable.
That's a message we all need to hear. Sleep is so important for our overall health and well-being. And it sounds like there are effective solutions out there even for complex sleep disorders. So it sounds like even with all these high-tech treatments, there are times when you need a little extra help to get your breathing on track.
That's right. In some cases, supportive therapies like supplemental oxygen or respiratory stimulants might be necessary.
So it's like giving your body an extra boost to help it breathe better during sleep.
Exactly. And of course, medication can play a role in treating certain sleep disorders or addressing any underlying medical conditions that contribute to sleep problems. It's all about finding the right combination of approaches for each individual.
It's like creating a personalized toolkit for better sleep. We've covered a lot of ground here, everything from basic sleep terms to those surprisingly common disorders and the fascinating ways doctors diagnose and treat them. I have to say, I'm feeling a bit more informed about my own sleep now. What about you?
I agree. It's amazing how much we can learn from diving deep into a single chapter of a medical textbook. And for me, the connection between sleep apnea and heart health really stands out. It's a powerful reminder that sleep is not a luxury. It's essential for our well-being.
That's a great point. It's not just about feeling tired, it's about taking care of our entire body. And to our listeners, if any of the symptoms we've talked about sound familiar, don't hesitate to talk to your doctor. It might be time to consider a sleep evaluation.
Absolutely. Don't suffer in silence. With the right diagnosis and treatment, restful nights are within reach.
So, to our listeners, I hope this deep dive has empowered you to take charge of your sleep health. Sweet dreams, everyone. May your nights be filled with deep, restorative slumber, free from any breathing interruptions or brain fog.
Sleep well.